Hello, beautiful humans, and welcome back to the show where we talk about your skin with the honesty it deserves and the science it actually responds to. You are listening to the AI avatar of Dr. Irina Lazuk, dermatologist, skin scientist, and the woman who has spent 20 years watching people wage increasingly aggressive wars against their own faces over dark spots and has some thoughts about a better approach. Dr. Lazuk is not with us today because she is currently perched on a research platform in the Namib Desert, Namibia, having accepted an invitation to consult on a study examining how skin with high melanin concentrations responds to UV stress under extreme environmental conditions. She arrived prepared for a 2-day visit. She has been there for 8 days. The research team reports she has taken over the spectroscopy equipment, reorganized the entire pigmentation data set by inflammatory origin, and delivered what they describe as an unscheduled but genuinely essential masterclass on post-inflammatory hyperpigmentation during what was supposed to be a lunch break. She has requested more data. They have complied. She is deeply happy. The desert, she reports, is clarifying. So you have the avatar. And today we are talking about something that is deeply personal for a significant number of people. Dark spots, red marks, the traces that skin holds on to long after the original event, whether that was acne, sun exposure, a hormonal shift, a procedure that healed unevenly, or simply inflammation that never fully resolved. These concerns are emotionally loaded in a way that other skin issues sometimes are not. They do not always feel dramatic, but they show up in photographs. They catch light in a way that makes skin look uneven, tired, or older than it actually is, and they accumulate over time, each one a small record of something the skin went through, until the face feels like it is carrying a history it cannot put down. The good news is that how we understand and treat these concerns has genuinely shifted, and the shift is in exactly the right direction. Here is what the old approach looked like, and why it so frequently disappoints people. Dark spots and red marks were treated as surface problems requiring surface force. Aggressive peeling, bleaching agents, high energy treatments are applied broadly to break up pigment quickly and get visible results fast. And yes, those approaches often produce short-term improvement. Spots faded, redness diminished temporarily. And then, for many people, something frustrating happened. The spots came back, sometimes darker than before. The redness returned. Skin became thinner and more reactive. And the cycle repeated. Treat, improve briefly, regress, treat again, leaving the skin progressively more sensitive and less stable with each round. This was not a failure of effort. It was a failure of understanding. Because here is what dark spots and red marks actually are at the biological level. They are both almost always driven by inflammation, not just triggered by a single event, but maintained by it. Pigmentation deepens when melanocytes, the cells that produce pigment, are overstimulated by inflammatory signals. Redness lingers when blood vessels remain dilated or fragile after the original stress resolved. In both cases, the skin is not just holding on to color, it is holding on to the memory of a stressor, and aggressive treatments that create new injury while trying to address old injury simply give the skin more to remember. Harsh correction triggers inflammation. Inflammation triggers more pigmentation. The treatment becomes part of the problem it was trying to solve. What has changed in 2026 and what Dr. Lazuk has been practicing for considerably longer than it became fashionable is a fundamentally different philosophy: precision over aggression, targeted correction that identifies and addresses specific chromophores, which is the clinical term for the pigment or blood vessels being targeted, while leaving the surrounding tissue as undisturbed as possible. Less collateral inflammation, more controlled healing, results that look like naturally improved skin rather than skin that has been visibly treated into submission. This is where technology, like the Candela GentleMax Pro, becomes genuinely valuable. Not simply because it is powerful, there are many powerful devices in aesthetic medicine, but it allows for selectivity. The ability to target melanin and hemoglobin specifically, adjusting energy settings, wavelength selection, and pulse duration based on skin tone, spot depth, vascular involvement, and the individual's history of inflammation or post treatment reactivity. That last part matters enormously because skin that is prone to post inflammatory hyperpigmentation, where the skin responds to any injury by producing even more pigment, requires a completely different level of restraint than skin without that history. For those individuals, aggressive treatment does not accelerate correction. It guarantees a worse outcome. Restraint is not a compromise, it is protection. When these treatments are done correctly, the skin is not shocked, it is guided. Dark spots gradually fragment and fade as melanin responds to targeted energy. Redness softens as vessels stabilize, and because the surrounding tissue has not been broadly injured, the overall tone often improves alongside the specific corrections. People do not just see fewer spots, they see calmer, more even skin, because the treatment was precise enough to correct without creating new stress for the skin to manage. But here is what Dr. Lazuk wants you to understand about even the most precise in-clinic treatment. Technology alone is never the complete answer. It is how it is used and when and what surrounds it that determines whether correction looks natural and lasts, or whether it produces temporary improvement followed by the familiar disappointing return. Barrier health matters. If the skin barrier is compromised going into any treatment, recovery will be slower and less predictable. Inflammation control matters. A skin that is already inflamed when treated has less capacity to heal cleanly. Sun protection matters. Not occasionally, not mostly, but consistently, because UV exposure is one of the most reliable triggers of pigmentation rebound, and any correction achieved without rigorous protection will gradually undo itself. And timing matters. Skin needs space to heal between sessions. The impatience that drives people to treat too frequently or too aggressively is often what keeps them stuck in the cycle they are trying to escape. Combination approaches, pairing targeted treatment with barrier supportive skincare and recovery focused protocols in between, consistently outperform single modality aggressive approaches. Skin that feels supported heals more intelligently. And skin that heals intelligently produces results that hold. Here is what the shift in realistic expectation looks like when treatment is done correctly. The first thing most people notice is not that specific spots suddenly vanish. It is that overall tone that begins to improve. Spots soften. Redness fades gradually and evenly rather than in patches. Skin looks more uniform before individual marks fully disappear. That is not a slow result. That is the skin healing the way skin is designed to heal, systematically from the conditions that created the problem rather than being forced into superficial change while the underlying drivers remain active. Clear skin is not perfection. It never has been. It is harmony, an overall evenness of tone and texture and behavior that makes the face look rested and healthy rather than uniformly blank. And when dark and red spots are treated with genuine respect for the biology that created them, with precision, with patience, with the right support around the treatment, that harmony is not just achievable, it tends to last because the skin was guided into correction rather than shocked into temporary compliance. And there is a very significant difference between those two outcomes, even if they look similar for a few weeks. Before we close, everything you just heard is purely for entertainment and educational purposes only and does not constitute medical advice, a treatment recommendation, or a clinical assessment of your individual skin concerns. Dark spots and persistent redness have many possible causes and deserve professional evaluation before any treatment decision is made. Please consult a licensed dermatologist for personalized guidance. Dr. Lazuk will be available for consultations as soon as the Namib Desert dataset is complete and someone arranges transport back from the research platform. She has apparently also started a side analysis on sand particle UV reflectance and its effect on ambient irradiance at the skin level. We are not sending a shorter flight. May your skin always glow as brightly as your smile.